Hey everyone, it's a few minutes past the hour, and so as people are coming in, I'll just make a few announcements. I see some new names and not new faces, but new names, and so just want to welcome you to the monthly meeting, the April monthly meeting of the Georgia One Health Consortium. So happy to have you here, and our normal format is to make a few announcements, talk about where the consortium's heading, and then we'll go into our talk. So hopefully everyone can see my screen. So just a quick announcement about the number of people who are part of the consortium. So far, I've been able to say every single month that we've been in existence, our numbers have continued to climb. So we have 166 people who have signed up so far for the Georgia One Health Consortium, which is really exciting. I believe we founded the consortium 11 months ago, I believe May 2025, with funding through the CDC allowed us to start the consortium. And so 11 months and we have 166 people signed up. That is up from 153 um, participants from the last meeting. And then we are up to 61 people on Circle, and that's up from 58 people in the last meeting. For those of you who don't know or need a refresher, Circle is our online community where we really just try to build engagement in between our monthly meetings. We have things like a member directory, we have a collaboration hub where people can talk about projects. We also post education and resources. We have a few things in our One Health toolbox, if you will, toolkit that are shared there, as well as just general announcements and events. You know, there's so much happening in One Health, both in the state of Georgia and globally, and we post a lot of things there. So if you have joined the consortium, but you haven't signed up to be in the Circle community, please drop me an email at ihla@georgiasouthern.edu, and I'm happy to send you those the sign-in instructions. It's also in your welcome email when you sign up for the consortium. But of course, the more people that participate in the Circle community, the more robust the discussion is. So definitely look forward to seeing you there. I am really excited to tell you about a new asset that we hope that all of the members will share with folks across their networks. So Dr. Mercer and Dr. Confer created this lovely recruitment flyer. We They did post it on the Circle community for people to use. But I can also send it to you in email as well. You can have it as a PDF or an image, but basically it's just a way. It's a flyer to really solicit additional members. So if you are on a campus community, like a university campus, then you can put this on like pin board. If you know other folks, maybe at your organization who may be interested in signing up, this QR code will take people to the sign up page. So certainly happy if you could distribute that across your networks. And I'll actually, Dr. Mercer, could you post it in the chat as well in case people want to download it from here?
Sure.
Okay, cool. Thank you.
Mhm.
Um, Again, just a reminder that if your organization is not represented here on the consortium website, we would love to add you. It's just a way to really see who's participating, but also like if you are at, say, Georgia Southern and you don't know that there are other people at Georgia Southern participating, it's a really cool way to connect within the organization as well. So we have a lot of support both locally in Georgia and globally. So really look forward to showcasing your logo here on the consortium website. I do also want to thank our volunteer leadership group. You can see their names here on the screen. We actually formed this group last month and started meeting in order to really push through on some initiatives that we started after last year's annual symposium. Of course, if you want to volunteer or you would like to take an initiative, under your wing and push it forward, we would love to have you. I think there's always room at the table for more things that we can do with this consortium. But just super happy to have folks who are willing to, spend some time working on the success of this group. So, as we discussed in the last meeting, we are thinking about, having another symposium, if possible. We are exploring, as a leadership, that volunteer leadership team, we're exploring different ideas right now, and we're trying to gather as much feedback from consortium members as possible so that, we can really make sure that this symposium is worthwhile for all of our consortium members. So please, if you have any ideas about the symposium or you would like to volunteer, please reach out to me. You can see my email here, or you can also send it to ihla at georgiasouthern.edu. I will say we are looking at two different locations in Macon right now and requesting quotes back so that we can see if it's something that we can afford. Just to remind you, last year's symposium that was hosted here at IHLA at Georgia Southern in Statesboro was mostly supported through a grant through the CDC. And that grant has since ended. And so we are looking at different options. And so that's why it says save the date, maybe. As a leadership team, we're going to probably decide within the next month or so. If it looks promising and if we could do it at low cost. But of course, while we're thinking about this, and we would love to hear feedback from everybody. Feel free to drop it in the chat, and I will take a look at it, or you can send me an email as well. So these are the dates we're looking at. So if you just want to kind of pencil them in on your calendar so nothing else gets scheduled, then that'll be great. But as I said, there's nothing like set in stone, but certainly it is. When we do set it in stone, we would love your participation. Becky, yeah, that's exactly what we're exploring, is looking at two universities to see what their costs look like. But if you know of people in the Macon area, then of course connect us with them if they have a background in event planning and stuff as well. Yeah, it definitely takes a village. So. Along those same lines, we were discussing if we had a second symposium, what that agenda may look like. We got a lot of great feedback at the end of the last year's symposium that really, pointed to the fact that people loved the diverse sessions that we had. And so we're really thinking about kind of keeping that in its same format. So maybe opening it up a networking session that evening, in case people have to travel, they can get there the day before. And then having a full day event on September 18th that includes things like lightning rounds, panel discussions, breakout sessions. Another thing that the leadership team had brought forth was the addition of a student poster session. If people were interested in that, maybe a silent auction as well to help raise funds, depending on the costs of running this event. And then, of course, having an exhibit hall. We had wonderful exhibitors last year that could, help spread the word of all of the wonderful organizations that are focusing on One Health across the state. And then a potential for people who want to stay in town. I know it goes into Saturday, but a potential volunteer opportunity may be in the works as well. A One Health volunteer opportunity. So this is what we're thinking, but again, would love your feedback either in the chat or in email, or we can schedule a meeting. But would certainly be happy to, entertain as much as we can as we start to think about these things. Um, okay, so I see a couple of people weighing in on chat already. I appreciate that. And I know I talk a lot, but feel free to come off mute and talk as well. Becky, thank you. I will definitely take you up on that offer and reach out to you. And yeah, uh, we would love some suggestions on keynote speakers, people that you really want to hear from with panel discussions or breakout sessions. Um, I can also send people last year's agenda so you can see who spoke last year. But yeah, I actually know a lot of people nationally and internationally who work in the One Health space, and so potentially we could get them here as well. Thank you. Okay. Comments, suggestions. Okay, fingers crossed that like next month's meeting will either be all in or have to postpone or think about, a 2027 option. But I'm hoping by next meeting we will have that really firmed up. So we'll go from there. Um, okay, so in between meetings, um, what can you do to kind of help the consortium? Certainly continue to spread the word, let people know that the consortium exists. We're also always looking for speakers, and would love to hear from a wide variety of folks. So as a reminder, the consortium is really meant to be all inclusive of individuals or organizations that are working in the One Health space, whether they call it One Health or not. And that includes universities, state departments, nonprofit organizations, community volunteer groups. Happy to have and happy to say that we have a wide variety of people and organizations that participate in the consortium. So feel free to contact me if you have any questions or concerns. I do want to say, unfortunately, our scheduled speaker had a family emergency and is unable to be with us today. And he was going to talk about animals to algorithms, so looking at the application of AI. And I know there's actually a lot of people who are into AI these days. The other AI, artificial intelligence, not avian influenza, though both are equally cool to study. So, but I'm thankful that Dr. Samples is here from, or was she retired from Fort Valley State University, and she'll tell you a little bit more about her background. But she has agreed to step in and talk about her white-tailed deer research that was looking at potential for zoonotic disease transmission in hunters in Burke County. So I'm going to stop sharing now, Dr. Samples, and turn it over to you. Hopefully you'll be able to share. And yeah, we appreciate you filling in at the last minute.
Okay, let's see. Okay, can you hear me? No, you cannot hear
Yep.
me. You
Nope,
can hear me?
I can hear you, and then
Okay,
I can see your PowerPoint, but it's not in presentation mode.
okay, hold on just a second here. There we go.
Yep,
Okay.
awesome.
Excuse me. Okay, so thank you very much, Jessica, for the introduction. As most of you know, I'm Dr. Samples. I retired from Fort Valley State in December. The presentation that I'm doing for you today is part of the data that was collected over a 5-year grant-funded research project that I have been doing while I was at Fort Valley. It started in 2020 with a beta test for a year and then ran until 2025 as far as the grant project. It was funded by the Evans Allen funding through the Stallworth Agricultural Research Station at Fort Valley State University. And as many of you probably know, I am by trade, before becoming the program coordinator at the MPH program at Fort Valley, I was a licensed, and still am, a licensed veterinary technician at Fort Valley State for 18 years. And so when I got my master's in public health and then a doctorate in health sciences, I still wanted to bridge the gap between veterinary science and public health, or veterinary medicine and public health. And lo and behold, One Health came along, and that was the perfect way to bridge that gap as far as I was concerned. So even though I worked in on the public health side of the house the last 13 years that I was at Fort Valley, my heart has always belonged to the veterinary community and to the zoonotic disease transmission subject matter. So the program today is an examination of the prevalence of gastrointestinal nematodes in white-tailed deer at time of carcass evaluation as a means of establishing potential for zoonotic disease transmission to hunters. And as Jessica said, this particular presentation is reflective of specifically Burke County, Georgia, which is over on the coast. It encompasses Waynesboro, that general area. I will give you a little bit of a warning and disclaimer that there's some photographs that are a little bit graphic, and some people may be disturbed by these. However, rest assured, they were all taken during DNR sanctioned quota hunts in Burke County, and all animals were harvested by hunters possessing a hunting license with the state of Georgia and adhering to hunting standards for the state of Georgia. So the research question that we were looking at that drove this particular project forward was, what was the intensity of gastrointestinal nematode infection in white-tailed deer in Georgia? And also, are hunters at risk of co-infection with gens while handling white-tailed deer carcasses? Now, this is for the purpose of this project, I have somewhat winnowed, or for the purpose of this presentation, I have somewhat winnowed down the total focus. This project also focused on COVID in white-tailed deer, and it focused on protozoal bloodborne diseases, which we will touch on briefly, but for this presentation, we're focusing mainly on gastrointestinal nematodes that may be infesting white-tailed deer. So the project had some public health relevance for several reasons. As probably everybody knows, white-tailed deer are extremely prevalent in the state of Georgia. You cannot ride down a road without seeing one's carcass on the side of the road, and if that's not evidence that we're overrun with whitetails, nothing is. However, besides that, hunting, as far as a human sport, is very, very popular in the state of Georgia. In the 2023-24 firearm deer season, there were no less than 630,000 licenses procured for hunting season in 23-24. That's a lot of people out in the woods with a gun, right? The hunters that are going out, basically they're hunting, and of course these licenses are for deer. There's also in many counties, there's a concurrent bear season that runs the same time that deer season runs in the state of Georgia. So, these people are out hunting. Generally, it's a very short window. It's from October until January each year. But suffice to say that there's a lot of people out there hunting deer. And this can be hunting in the backyard. It can be hunting at quota hunts. There's many different scenarios and environments for deer hunting that people undertake during the hunting season. However, when you're hunting deer, the way that very short and simply they go out, they shoot the deer, deer falls dead, and then you have a choice. You can either field dress it, which means that the hunter right there wherever the deer drops, they go ahead and do a incision and remove all of the body organs so that it lessens the weight of the animal because they may be looking at dragging this animal out of the woods and it could be, you know, a half a mile or it could be a mile and a half in the woods. So they're not necessarily rolling right up to their tree stand in an ATV and then able to load the deer up. They usually have to walk quite a ways to get to their tree stand. Or they may be walking and hunting. You know, not everybody hunts from a tree stand. So suffice to say that the less weight that you have to drag out of the woods, the better off you are. So the hunters that are really at risk for transmission of zoonotic diseases are those that are basically doing what we call field dressing of the carcass before they bring it out of the woods. Other populations that are also affected or could be potentially affected would be, of course, when you get it to where you're going to have it processed, or if it's a quota hunt, the DNR technicians that are handling the animal's carcass, you take it to the processor, you've got processing technicians that are doing, in essence, field dressing, but at the coolers. So they're, you know, obviously going to be at risk because they're coming in contact with not only the viscera, but blood, fecal matter, etc. And so these are all people that could taxidermist. You take the head in to have it mounted on your wall. You got to take it to a taxidermist. Taxidermists are another very much under-recognized population that could be affected by zoonotic diseases from any number of animals, because of course they do the work to make these animals pretty to hang on the wall, and they do everything from fish to raccoon to any type of mammal that you bring them. So there's a wide variety of zoonotic diseases that they may come in contact with. So the Georgia DNR sanctioned quota hunts, these are hunts in which the Georgia DNR holds a lottery and you apply, send your name in, and then if your name is drawn, basically the lotteries are for every county that holds a quota hunt. Not every county holds these, but you pick the ones that you want to be in the lottery for, and when they draw the numbers, if you are chosen, then you are given 3 tags to hunt during that quota hunt, which is in a specified area on a specified date. And you can go in and hunt, and then anything that you take or that you bag during the hunt, you're required to present it at the quota hunt check-in station where the animals are weighed, sexed, and aged according to their dentition or their teeth. And that way it helps the DNR to keep up with the number of animals that are taken in that area and also what the population looks like in that area as far as males, females, and the different ages. So Burke County, again in Waynesboro, they host 3 quota hunts every year, and they are hosted at the Dylane Plantation Wildlife Management Area. It's an 81,000 acre federally designated wildlife management area that was gifted to the DNR many, many years ago by a family that actually had a home there. And it also is the host to the only bird dog cemetery in the country. And so there is a very large cemetery there on the premises. If you're ever over there, it's worth stopping and just taking a look at it. The gentleman that owned the plantation, he was a bird hunter. And so he loved his bird dogs. And so there's something like 50 or 60 bird dogs buried there. There's a mule buried there. The family cat is buried there. And it's quite nice. I mean, it's a regular cemetery with little markers, and it's beautifully kept up. The DNR does a wonderful job of keeping this up. So it's one of those unknown little treasures of the state of Georgia that if you're ever over in that neck of the wood, go take a look at it because it's really something to see. So the role of the field experience in terms of how this manifested with my project was I used the project. One of the things about Evans Allen projects is you have to include students in it. And so I included graduate students that helped me with my collections. And in this case, it was a young lady named Tanisha Wilson, and she actually was my runner. She was the person that facilitated the transportation of samples from all around the state of Georgia to getting the samples where they needed to go to be analyzed. So certain samples came to us there at Fort Valley, and then certain other samples had to go to the Tifton Diagnostic Lab down in Tifton, Georgia, which is the UGA veterinary diagnostic labs for the state. She also was responsible for helping correlate the data so that we could perform statistical analysis. And then she, as part of her field experience, performed all of the statistical analysis and interpretation as it related to public health significance and the populations of uh, hunters and other people that could be affected by these potentially zoonotic disease carrying animals. So fecal samples were collected digitally from deer carcasses, bagged and kept in a refrigerated cooler for transport. We also started doing nasal swabs during COVID because at that time there was not a lot known about the prevalence of COVID in wildlife or any animals, even companion animals. And so the Tifton Diagnostic Labs received a federal grant in order to assess COVID testing of wildlife and other animals. And so they looped us into that process so that we did not have to pay to have the testing done. All we had to do was buy the COVID test kits, which were the same ones that were being used in human for nasal swabbing. And then we would just send everything to Tifton and they would run the test for us. Blood samples, we retrieved blood samples from the carcasses, generally the abdominal area, and we tested for bloodborne pathogens that affect humans, such as anaplasmosis. As I mentioned, Tanisha was our transportation expert, so to speak. And so basically all the fecal matter was transported to the Stallworth Agricultural Station to the lab of Dr. Tom Terrell, where they did all of the fecal eggs per gram of feces testing on all of our fecal matter. And then they also not only quantified how infected animals were, but they qualified the results in terms of identifying the eggs so that we would know exactly what gastrointestinal nematodes we were looking at. Blood was transported to the Department of Vet Science, to my lab, where we did manual blood smears and read them to look for anaplasmosis. And then also nasal swabs, they were transported to the Tifton Veterinary Diagnostic Labs because they at that time were the only one that could do the COVID testing on animals for the state. For the fecals, the McMaster's test or McMaster technique is how we analyze for eggs in the fecal matter, and that in turn allows us to identify those eggs after we quantify them, and then we can identify to determine which gastrointestinal parasites are actually infesting the animals. As I mentioned earlier, we did direct microscopy examination to look for anaplasmosis, and that was a very simple, making a blood smear and staining it, looking at it under a microscope. And then, of course, Tifton Diagnostic Labs, they use PCR testing for COVID. And what they would do is they would test every swab twice. We would send in two swabs, and a right and left nares or nasal swabs, and they would test each one with PCR testing. So after we finished up 5 years of doing the collections, we had to compile data sets. And so basically we have done data sets for Burke County. This is our first county that we decided to look at because they had the most samples every year of any county that we collected in. And so we figured, well, let's take the largest sample because they're going to give us the best statistics and it'll be the easiest to work with as we're starting this process of data analysis. As I mentioned earlier, it was all data was collected between 2020 to 2025, and actually that would be October 2020 to January 1 of 2025. Hunting seasons, again, in Georgia run from October to January. And of course, Burke County had a total of 3 quota hunts each year there at Dylane Plantation. So that meant that over the course of all those years, we attended 15 quota hunts at Burke County specifically. And the actual, and oh, I'm sorry. The actual, I apologize that this picture is right over part of my data. However, there were quota hunts every year from 2020 to 2025, and they ranged anywhere from 45 to 63 in numbers. So again, not every county has quota hunts. The way that they determine where to have the quota hunts is basically done after the season has ended, the hunting season has ended. At some point during the first part of the year, each county, each DNR in each county will do an assessment of how many deer are located in that county. Now, that doesn't mean they go out and sit in a tree and count them one by one, but it is done using calculations according to how many are hit by cars, how many are reported as being nuisance mammals in farms and urban areas. And then they pick the areas that actually are considered to have the largest population of white-tailed deer. That's where the quota hunts generally are held so that they're able to go ahead and try to cull the herds, so to speak, and decrease that number of animals. So the number of samples that we collected in Burke County, we have here, there was a total of 570 deer were sampled. And these are the numbers. 4 out of 5 of the years yielded over 100 samples. The 21-22 year, it actually yielded over 100 samples. However, only 86 were viable. We had some that just, by the time we got back to the lab, the blood was clotted and they had to be discarded because they were not testable. However, based on the fact that we had such a large sample size and consistently had over 100 samples, we felt like this was a very robust sample. And so it made for some good statistical analysis. So by year, this is just basically showing you what the dates were. And you can see that they basically tried to stay within about the same first part of October, second part of October, and first part of November for their quota hunts in Burke County. And then we have here, according to how many deer were taken during each hunt. And so sometimes there were large numbers, like 68 during one hunt, and then sometimes it was as low as 17. We went to some hunts in other counties where the most we ever did was maybe 40, and we came home with nothing at some times. And of course, then we also wanted to just show that the number of hunters that were in the lottery or that won the lottery for Burke County at those hunts generally was a little less than 200 but they generally range somewhere between 400 and 500 for the season. So, as someone said earlier, it's a large county. There's 1,800 acres is a nice large area to hunt in, and so they could very easily accommodate large numbers of hunters. And of course, some of the hunters don't hunt um, the whole time. As you notice, all of these hunts are 3 days. And so some hunters go out for the whole 3 days. Some people can only come out Saturday and Sunday. Some people only come out on Saturday. You have some people that are particular and only want to hunt in the morning, while others want to hunt at night or at dusk because it's illegal to hunt at night, but at dusk. And so you don't necessarily have 564 people or 196 people roaming around at the same time in the woods. They're pretty much scattered throughout that 3 day period. As far as the number of things that were positive, this is one of my most interesting slides because it shows you exactly what types of things we were finding. Now, with the blood samples, it was all about anaplasmosis. And so anaplasmosis, as you can see, not a lot of it. There were some cases, but overall, it was not something that was to become too frightened that people were going to be affected by it. The COVID, the year 23-24, we had 4 cases of COVID deer in Burke County. That is the only year that we saw any COVID reactions in the test. And Tifton became so excited by this that they actually sent their uh, the samples out to a secondary lab just to have it confirmed because they wanted to make sure that this was not just a fluke and that we were not that their testing method was not in error in any way. And secondary laboratories confirmed that these 4 cases were COVID in white-tailed deer, and it was the only, to my knowledge, we were the first to demonstrate COVID in white-tailed deer in the state of Georgia. Now, the gastrointestinal nematodes are another matter. And again, you have to look at the number of fecal samples versus the number of positives in order for the numbers to make sense. But there were a lot of the deer in Georgia are infested with gastrointestinal nematodes, which is not surprising. But this just gives you an idea of the positives number in the amount of samples that was taken, which was significant. And again, this is just percentage-wise what the positive samples represented as in terms of overall samples collected for that particular type of sample and that particular uh, pathological being that we were looking for. So the statistical analysis we did not go with a long, drawn-out statistical analysis. We basically looked at parasite load, which is very important because it determines a couple of things. It determines what the potential is for the environment to be contaminated with parasitic eggs and larvae. And for those, and I know we have some parasitologists that are in our consortium, but for those that are not heavily invested in veterinary parasitology or any parasitology, gastrointestinal nematodes require, for the most part, most of them require some time on the actual environment that the host is living in. And so you have gastrointestinal nematode eggs, say in the white-tailed deer. The deer defecates in the forest, on the ground, or in the pastures if they're sharing a pasture, because they will jump fences and try to share pasture with cattle as a way to avoid predators like coyotes. So they're defecating the fecal matter on these pastures. At some point, the eggs mature into for lack of a better word, they mature into larvae, and there's several stages of the larvae, but the L3 larvae, um, which is the last larval stage, it migrates up the blades of grass to get water. And then the cattle or the deer or anything else that's a grass eater comes along grazing and nibbling at that grass, and they ingest the larvae. And that's how you have the cycle of continuation with these gastrointestinal nematodes, because now the larvae are back in the body where they mature to adults. Then they have lay eggs, and then those eggs are graded, and it just continues on. So it's not surprising that the GINs would be prevalent in the white-tailed deer. However, by demonstrating the parasite load, we can look at not only if the deer are heavily infested, then they're going to heavily contaminate the environment and perpetuate that cycle I just described, but also it gives you a way to get an idea of how infected particular areas animals are. And so in this case, Burke County. Parasite load in the literature, if you look at some of the different papers that have been written, it has remained a critical metric that is used within the One Health movement as a way to recognize correlations between wildlife veterinary medicine, human medicine, the environment, and public health. So it's One Health wrapped into one. We basically calculated the parasite load looking at the mean intensity, which is the average number of parasites that are per infected deer, as well as the prevalence, and that is the fraction of a total host population that at any one given time was infected. And this is just the calculation. And here is our mean intensity. As you notice, it's quite high. And this is only for gastrointestinal nematodes. We did not do this for the anaplasmosis or for COVID, but strictly for the gastrointestinal nematodes, the mean intensity is quite high for all years except the last one. And I do not really have a rationale as to why certain years were a little bit more there was more infections than other years, but this is our mean intensity. The parasite prevalence, again, fraction of the total host population that was infected. And here we have our prevalence. The first year, we did not have very many infected animals. So this 2020, 2021 year was a beta test. And what I mean by that is I basically self-funded this to make sure that it would work before I wrote the grant. I'd never written an Evans Allen before, and quite frankly, I did not want to just fall flat on my face with something that wasn't going to work. So we only made for we actually only were able to get to about, I want to say three or four counties during that year that we actually were able to get to, because it was just myself and one other person. But every year after that, we were able to look at a lot of different counties, and certainly we were at Berks for all three of their quota hunts. And so this is just giving an idea of the prevalence. So what do you take away from all of this? Well, obviously, parasite load is probably the best way for us to assess any data that we want to use to try to show the One Health movement's correlation between the vet medicine, the human medicine, and public health. However, for Burke County, 80% of the season tested had over 50% of the animals that we tested were infected with the gastrointestinal nematode Homunculus contortus. Now, Homunculus contortus is also known as the barber pole worm. The worm itself looks like a barber pole, an old-fashioned red and white striped barber pole. This particular parasite is detrimental to the ruminant species that we typically raise as livestock, cattle, sheep, goats, those types of animals. And so it was interesting to see that, so many of the deer were infected with this specific one, because as I mentioned earlier, deer love to hop the fence and graze with cattle as a way to escape the predator. And so they could be spreading this to a farmer's treating his animals. He feels like he's got a good parasite program. All of his animals have been treated, but he's not noticed that there's some deer that are grazing there with his cattle, and they're perpetuating a continuation of that infection cycle. 2022-23 hunting season had the highest prevalence. It was at 51.3%. There was a total of 489 hunters that hunted during that time. So you've got this particular group would have been at risk for the possibility of infection with gastrointestinal nematode. And then in the total number of hunters that hunted over the whole course of our program was 2,370 hunters. So that's a mean calculation of roughly 474 hunters a year that we could look at as a sample population that could be adversely affected by Homunculus contortus. So, what does Homunculus contortus mean to humans? Human infection occurs through accidental ingestion of the infective L3 larvae. Now, are the eggs. So, all of you have this burning question now of how on earth are you going to eat L3 larvae or eggs of a gastrointestinal nematode? Well, number one, they're microscopic, so you're not going to see them. But the main ways that have been cited in the literature and that I have observed myself at some of these quota hunts is things like chewing tobacco. So they just killed the deer. They're they're doing their field dressing, and somebody reaches in their pocket and takes out a wad of tobacco and shoves it in their mouth, and they just got finished handling this animal and they've not washed their hands. Same thing with eating or drinking while field processing. Now, they may not be eating or drinking while they're standing over this thing trying to remove its viscera, but upon finishing the field processing and dragging it out of the wood, and of course, your hands are dirty, and then you get to the truck, and then what's the first thing that happens after they sling this thing on the truck? They either get a bottle of water to drink, they grab a pack of crackers out of the cab of the truck, tobacco, light a cigarette, light a cigar, whatever. But again, all of these things, you're using hands that have not been cleaned after you process this animal, and basically we're handling viscera, handling the intestines. The intestines are full of fecal matter, blood. And so basically, a lot of times it's all about poor hand hygiene during the field processing or handling of a deer carcass. Or hands and mouth during field processing. And I know this sounds horrible and gross, but nail biters, you know, picking at your teeth or whatever. Anything that has your hands or the hunter's hands going close to their face is a potential way to be infected with Homunculus contortus. As we mentioned earlier, the populations, we were mainly concerned with hunters. However, we also recognized through this study that there's under-recognized populations of people that could be at risk, including taxidermists, the wild game processors, Department of Natural Resources wildlife technicians that answer the call when somebody hits a deer and it gets knocked over in somebody's yard and it has to be removed. These guys go out, they do a fabulous job at helping people and troubleshooting when things like this happen. But again, they're handling dead animals. The symptomology for Homunculus contortus, it's very similar to intestinal flu. fatigue and weakness. You may be a little bit pale because of anemia, if in fact you went a while with this, because of course Haemonchus contortus feeds on blood in the intestinal tract. It basically um, goes through when it gets to the intestines, it hooks into the intestines and just sucks blood. And so anemia, and of course abdominal pain, nausea, diarrhea, but all things that you might think of as, oh, I've just got a flu bug, or oh, I've got a stomach virus. If it occurs 10 to 12 days after exposure to these animals, it may be worth mentioning to the doctor that, hey, I was hunting recently and I field dressed a deer. And is there any chance I could have picked up a parasite? A simple fecal exam will tell whether or not you have picked up a parasite. Public health wise, again, it's Haemonchus contortus represents a zoonotic disease process. There's definitely a need for awareness among those that handle deer carcasses during field dressing and meat processing. At every quota hunt we went to, we passed out pamphlets to try to educate people about good hand hygiene, safe handling practices. And every person that we talked to, they were like, thank you so much for telling us about this. We had no idea. Surveillance, as far as public health surveillance, is very limited at this time. This is not a reportable disease. It's not a reportable parasite. It's not like rabies or some of the things that the state gets involved with where you're reporting it to them. And it's also somewhat rare. And that rarity is not necessarily due to the fact that not many people are infected. In many cases, it's due to the fact that the diagnosis is not made. And of course, as far as food and food surveillance, there's a need for continued public health oversight and safe food handling of deer meat to prevent cross-contamination. And that would be, again, with your processors. Are they licensed by the state to process the meat? If they are, then they know the process of trying to keep this food or this meat safe during that processing so that you're getting a good product that's not contaminated by gastrointestinal parasites. These are my references. And that is the end. And I would love to entertain any questions if, in fact, I have any audience left at this point.
Thank you so much, Dr. Samples. I have to say, like, a couple of the things that you stated, it kind of sent me off in a rabbit hole because as somebody who lives on a farm with a lot of dogs and frequently, unfortunately see deer carcasses way more often than I want to see. This truly is a One Health issue, and it's just so interesting to hear. And so I'll just open the floor to anybody's questions, and you can come off mute if you'd like, or put it in the chat.
Rita.
Hey, there he
Hey
is,
there.
my partner in crime. This is Dr. Tom Terrell. He actually did all
Okay.
the fecal work for us.
But I have a question. You said you were seeing yearly differences. Have we looked at like rainfall in each year and things like that actually affect, you
I
know?
have, and that's a good question because I have not at this point. However, comma, that is on my radar to go back and pull up because you can go into, there's a site, I forget where it's at, but it's with the weather people. You can go in and see what the weather conditions were on specific dates, and that's
Oh, yeah.
a paper that's a paper unto itself because if you had a really dry season, I would expect you would not see nearly as much infestation as you would during a really wet season. And of course, we all know how Georgia is. We've had seasons where I've seen people out there hunting in coats and jackets, and then I've seen seasons where they were hunting in shorts and t-shirts. So,
You can
you know,
access that data very easily. There's a Georgia automatic weather station thing that's, has weather stations all over the state and has it by day, humidity,
exactly,
high and low temperature, rainfall, so forth. And so,
And I think that would be an excellent, that would, like I said, that'd make a nice paper just to itself because, it definitely is, the weather pattern do play a big part in the survivability of the parasite as well as the movement of the animals.
Right.
So
We can get Dr. Siddique involved and start doing some predictions for what we'd expect on a year.
absolutely.
So
Ab-
Dr. Siddique is who was going to be giving the talk today, but his daughter is really sick.
yeah,
Unfortunately.
they were heading to the emergency room at 11
Yeah,
o'clock. So, yeah,
it's just her fever won't break. So it's
that's the
just
part.
sad.
But yeah, well, thank you for that question. I appreciate that. And I'm so glad you're here with us because you could sort of troubleshoot if I missed anything that was of,
You did a very thorough job. That was fantastic.
Yeah, that was a great question. Dr. Mercer.
Well, I was gonna say, Loretta, this could have been a talk like focused on my family. So, growing up, I feel like my dad and Papa and everyone fishing and hunting, they didn't wash their hands, and I feel like it's because they thought, oh, it's natural. It's fine. It's natural. It's not gonna make me sick. I don't know if they thought about gastrointestinally or not, but I don't think they were worried. They just thought it's like this is not and so sometimes they wash their hands, but I went camping for full weekends and none of us washed our hands and we fished all weekend and had worm guts and so it's a getting over certain mindsets, I think, is a big challenge. But showing them this stuff, I think, kind of helps. But yeah, it was more of that's natural, so I'm not going to get sick feeling. I don't know. It's like that's what they would say.
well, and I would even, and this is another presentation for another time, Katie, but we also did something similar with fish, and we did it just on the ponds there at Fort Valley State has a pond that is stocked, and that was unbelievable because I would have never thought about handling fish that you could get a zoonotic disease from them, but we sent them to Tifton and had, all kinds of things done. And I mean, again, it's a presentation for another day, but you're absolutely right. I mean, in the olden days, just wipe your hands off on your pants and keep going. And if you did get sick at the end of the weekend, well, that was kind of to be expected. You just spent the weekend in the woods and, you just kind of blamed it on, maybe we didn't cook something well enough or, but I was shocked at the reception we got from the hunters because I really expected to get some pushback when we tried to educate and our form of public health education was not formal. It was standing by the truck talking about this and they say, well, what are you guys testing for? And we would use that as a way to say, oh, well, we're testing for this. Well, what do you mean I can get sick from these things? And in fact, we had down in below Valdosta, one of my MPH students attended a quota hunt for us down in Valdosta. And the guy became so convinced that maybe he could get sick that he gave her the deer carcass and she paid to have it processed and had her freezer was full for the year. He was like, no, forget it. I don't want it. I'll just take the head and we can have the meat. So,
A win-win.
Now it was a win-win. And Jessica, let me just go back to what you said a minute ago about having dogs. I don't know about your dogs, but I live out in the country too, and we have deer on the property and we have rabbit. And my deer seem to think that rabbit poop and deer poop are God's natural M&Ms. If I go out on my patio, I'm screaming constantly, drop it. Don't eat that because they seem to love it. And again, it's a good way to get parasites, not just homuncus, but it's a good way to just get parasites across the board.
Yeah, country living isn't for the faint of heart, that's for sure. So
let me tell you, country living is keeping my veterinarian, is putting what I spend at the veterinarian on country living and the things that happen around here is putting his daughter through vet school.
yeah, well, I know we're short on time, but I will say my veterinarian got to see one of my dogs this week because of a rattlesnake bite. So
oh boy,
it's so we're thankful for our rural veterinarians for sure. So Mhm.
Did your dog had it had the rattlesnake vaccine?
No, but he got some anti-venom and
Yeah.
he's back at it again. So but
Okay.
you know, I think it is interesting from a One Health perspective though, because frequently we forget those intermediaries where very rarely do you have that kind of zoonotic spillover from wildlife to directly to humans, but rather, you know, we have our companion animals or domesticated animals that provide that kind of handoff, if you will, when you're looking at zoonotic spillover. So, well, I just want to wrap, the meeting up. I will certainly stay on for a little bit more, but just thank y'all all for attending. And like previous meetings, we'll be sure to put this on our YouTube, by the next meeting. And it was great again to see some new names and definitely join us for our May meeting. And I'll send out emails for that. But thank you, Dr. Samples. I appreciate it.
Absolutely, anytime.